Coming up, we'll be on location at the Vascular Institute of Virginia in Woodbridge, Virginia, discussing the latest advances in vascular surgery and how they can effectively treat peripheral arterial disease, varicose veins, and other related health problems with one of this region's top interventionalists, Dr. Anish Shah. Dr. Shah is a board-certified nephrologist with an added certification in vascular access procedures and completed his medical degree from Ross University Medical School, and he is widely recognized as one of this region's leading doctors. Welcome, Dr. Shah. It's a pleasure having you on our program.
Thanks for having me.
We have a lot to talk about. We have a few patients that are going to be joining us a bit later, but I wanted to begin, if I may, Doctor, by having you please tell us what a vascular and interventional nephrologist is.
Sure. Well, I'm a physician that specializes in minimally invasive vascular procedures. The types of procedures that I do and that we at our team here at the Vascular Institute do include hemodialysis vascular access procedures, procedures for peripheral arterial disease, procedures for varicose veins or venous reflux disease, as well as other types of outpatient venous access and vascular access procedures.
And I understand you utilize minimally invasive techniques. Is that correct?
We do.
Okay. And what types of health problems would you say that these address?
Well, for patients who are on dialysis, we address their access needs, the vascular access needs. For people that have peripheral arterial disease, we address the diseases in their blood vessels that they have. And for people with the varicose veins or venous reflux disease, we address the refluxing veins.
Oh, very interesting. And now what about venous access?
So for patients that require venous access, for example, patients that require a port or a PICC line, these are access to the bloodstream for patients that either require antibiotics or chemotherapy or medications.
Oh, okay. That's certainly good to know. And I wanted to follow that up by asking you if you can please tell us about the hemodialysis vascular access as well.
Sure. Patients who are on hemodialysis typically have a fistula, or a graft, or a catheter. And any access, regardless of what it is, can be problematic, and that's what we address.
So you take care of quite a few things in a very efficient and effective manner for your patients here.
We do.
And what would you say are some of the warning signs, Dr. Shah, that you may have an issue with regarding your access? Sure.
Well, one of the things we advise all of our patients that have a dialysis access is to examine the access every day, putting their hand on it. If they don't feel a buzzing, which we call a thrill, it's important that they call their doctor right away, and they oftentimes have to come and see us. There's other issues that can happen with that, and as patients recognize their access, they'll notice that sometimes it feels different, or it's maybe red or inflamed or something like that. Those are the types of situations that we ask our patients to look out for, and if there's a problem, to give us a call.
And can you tell us more, Doctor, about the peripheral arterial disease that you mentioned earlier?
Sure. Peripheral arterial disease is a disease of the arteries that predominantly affects the lower extremities, legs and feet. Some of the risk factors that predispose people to PAD is diabetes, high blood pressure, high cholesterol, smoking, and advanced age.
Are there any symptoms related to PAD that we need to be aware of or watch for?
Sure, absolutely. So as far as symptoms are concerned when it comes to PAD or peripheral arterial disease, the first thing that patients commonly complain about is exertional pain. So if they start to walk a block or two or three or four, they may notice that their legs get tired or become painful and they have to stop. As the disease progresses and gets worse, that pain happens with less and less exertion until sometimes that pain happens even at rest. Some people then develop ulcers that don't heal or heal quite slowly because they're not getting enough blood supply. That can also be associated with a discoloration of that part of the leg. And ultimately, this can lead to infections and amputations.
Oh my goodness. So you really have to ideally catch it early so it doesn't lead to those type of very serious problems.
Early diagnosis and treatment is very important.
Yes. What would you say, Dr. Shah, are some treatment options that are currently available that can help with these problems?
Sure. Well, so assuming we've seen a patient in consultation and they have peripheral arterial disease that is amenable to minimally invasive treatment, which is what we do, the types of treatment we have include angiography, which is looking at the blood vessels with a contrast agent, angioplasty, which is a stretching of the blood vessels with a balloon, atherectomy, which is sort of removing the plaque that has built up in those arteries, as well as potentially placing a stent to help keep that vessel open.
Very interesting, and I understand from what we've heard regarding this treatment, as far as correcting PAD, it's minimally invasive as well as under moderate sedation. Is that correct?
Correct. So what that means is patients come in for their treatment and they leave the same day. The level of discomfort is very little to none because they're sedated. And because it's minimally invasive, the patients are able to have the procedure and go home the same day.
That's certainly very good to know, Dr. Shah. And what kind of results are we looking at from this?
So with any of these treatments, what we would consider a successful outcome is if the symptoms that the patient had were alleviated. So for example, if it was a patient that had pain at rest, we would expect that pain to improve. Or if it's a patient that had an ulceration or a wound, we would expect wound healing to be promoted and for the wound to heal.
We're now going to meet some patients of Dr. Shah. Welcome, Ginger. Thank you for coming down today.
It's a pleasure.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Ginger, by having you please tell us what health problem or problems were you experiencing that brought you to the Vascular Institute of Virginia and Dr. Shah.
I'm on dialysis and I have a fistula in my left arm. And at one point in time, I was constantly having bleeding problems with my fistula. Was going to many different doctors trying to get it stopped because I was going to the emergency room all the time. Found Dr. Shah and he was able to get it under control, explained to me what was going on, and got on a schedule with him to keep it up.
That's wonderful. So in other words, before you came to Dr. Shah, you were really in literally a life-threatening situation with frequency where you said a moment ago you were going to the emergency room quite often as the bleeding would begin again.
Yes.
So then you came here to Dr. Shah, and what did you have done, Ginger?
He did fistulograms, but also more important, explained to me what was happening, why this was happening. He got me on a schedule that fit my fistula, and now it's got it under control.
That's wonderful. And how is it affecting your life now?
Oh, much better, much better. I'm more calm and I'm not as hyper about my arm as I used to be. More relaxed about it.
That's great. You're enjoying your life again, I take it.
Yes.
And lastly, before I let you go, Ginger, for the folks out there watching, what would you tell them about your experience, not only with Dr. Shah, but the staff here at the Vascular Institute of Virginia?
They're wonderful. All of them are wonderful. And Dr. Shah has great bedside manners. You don't feel like you're just a paycheck to them. You feel like they all care. They all care about you when you come here.
Well, on that note, we'd like to thank you, Ginger, for joining us, sharing some of your experiences, and being a guest on our program.
Oh, thank you.
It's our pleasure. Welcome, Marcus. Thanks for coming down. We love having you on.
I'm glad to be here.
Now, I wanted to begin by asking you as well, Marcus, what brought you to Dr. Shah and the Vascular Institute of Virginia?
Well, I met Dr. Shah. It's been at least 7 or 8 years ago. I've been a dialysis patient for 26 years. And I was referred to Dr. Shah by one of my doctors at my dialysis unit. And when I first met him, I mean, it was like a night and day thing. It's like going from dark to light. He's one of the best doctors I ever seen. So ever since then, he's been my doctor to turn to when I need his help.
Oh, so because of you, like you just mentioned a moment ago, you've been a dialysis patient for 26 years, and then you were going through other folks before, but the last 7 or 8 years since you came to Dr. Shah, you've loved him so much that you just stayed with him.
Oh yeah, I'm not going anywhere. I'm staying right here.
That's great. What have you had done over here?
Declots, just checkups. That's about it, you know. Just basically keeping everything running fine.
And how do you like the results so
beautiful,
far?
Beautiful. The staff, Dr. Shah, I love everything about this, coming to the Vascular Institute of Virginia. I love it all. You look for a comfort zone. Like I said, I've been doing this a long time, and when you're comfortable with something, you don't want to change it. So, and Dr. Shah is the best doctor I done had in the 26 years I've been doing this.
That's wonderful. Wonderful. And on that note, we'd like to thank you as well, Marcus, for coming down and being a guest on our program.
I appreciate it. I appreciate it.
Welcome, Marco, and thank you for coming down and joining us today.
Thank you for having me.
Now, I wanted to ask you, Marco, what brought you to Dr. Shah, and what did you have done?
Well, I was actually experiencing some pain issues with my legs. I have varicose veins. I saw Dr. Shah and started the varicose vein procedure and process, and basically getting an ultrasound done, and I actually had a procedure done with him.
Oh, and how do you feel about the results from that procedure?
I feel great, actually. My legs aren't in pain anymore. I don't feel, they're very heavy or anything. I'm not experiencing any issues. Walking just fine, so that's always a great thing, yeah, especially after the vein ablation, so it was really good.
That's wonderful. So in other words, prior to coming here to Dr. Shah and having that done, that procedure done, you really must have been experiencing not only pain, but it must have been affecting your life as well, the quality of life.
Oh, it was, definitely. I can experience numbness, tingling, all those with my legs, and I feel so much better now. I don't feel any of that. I'm following the regimen like he says, Tylenol and compression stockings and basically elevation of the leg, and I just feel so much better. I feel like I can run and everything. And for me to be so young to say that, that's, a big thing. So I'm just so thankful for all that.
Yes, indeed. We're so happy to hear that, Marco. And before we let you go, what would you tell all the folks out there watching about your experience with not only Dr. Shah, but the staff here as well at the Vascular Institute of Virginia?
Dr. Shah has a great quality of staff. He really, really backs his work very, very well. He just makes sure he stays on top of the patient. He makes sure that the patient follows the regimen as he has told. If there's any issues or any problems, his door is always open. So I always recommend, Dr. Shah to all of my friends. If you have any issues or any problems with your varicose veins or legs, definitely give Dr. Shah a call and, make an appointment.
Well, on that note, we'd like to thank you as well, Marco, for coming down and sharing some of your experiences and being a guest on our program. It was our pleasure.
Thank you so much for having me.
Thank you. We're now back with Dr. Shah. I must say the patients are very happy with the results, not to mention the great attention and care that you and your staff provide. Now, we're literally out of time, Dr. Shah, but I wanted to ask you, before I let you go, you and your practice, the Vascular Institute of Virginia here in Woodbridge, Virginia, have certainly established a reputation for excellence in treating vascular health problems and in providing high-quality patient care, not just in the Woodbridge area, but throughout Northern Virginia. You have patients that come to you from throughout this region, for that matter. I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
Sure. So we have a state-of-the-art facility and an all-star team. Our team is dedicated to providing an outstanding experience in an outpatient setting. And I feel that we do that on a day-to-day basis.
And also, not only the patients that we interviewed a few minutes ago today, but others we've talked to through our research all attest to the fact that you and your staff here at the Vascular Institute of Virginia really seem to treat each patient like family, and that's not something you hear too often these days.
Well, thank you. That is our goal.
Well, on that note, we'd like to thank you, Dr. Shah, for joining us, being a guest on our program. We'd love to have you back on in the future.
Well, thanks. Thank you for having me, and I would love to come back.
Thank you.